Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening right here from Horizon TV. Ramadan Mubarak and some Makbul. Right now you must be sitting and enjoying your iftar either with family or all alone. Of course, thanks to this COVID-19 pandemic, curfew has been brought to 8 p.m. from the previous 10 p.m., forcing some bachelors to break their fast on their own. And those who are not in family setups, of course, they have been forced to break their fast on their own. But nonetheless, we pray to Allah subhanahu wa ta'ala in this holy month of Ramadan, on this blessed day being on a Friday, to alleviate this pandemic from us. And tonight we'll be talking about the coronavirus vaccine. This is a process that has been rolling right now in this country for some time now. And out of the current 149,219 cases, DIZ, I'm talking about the 5 counties that have been locked as one zone, the disease infected zone, is facing, or rather is experiencing, a plateau in terms of infection for the past 2 days. We thank Allah subhanahu wa ta'ala for that, and we are asking, may the Almighty alleviate this pandemic from us. Now, at least 422,021 individuals in the country have received the jabs of the coronavirus, that is AstraZeneca and Sputnik, before it was banned from this country. That is 0.80% compared to 840,944,931 globally. That is 10.78% people who have received their COVID-19 jabs. Have you received yours? Do you have any questions in regards to this vaccine? I have Dr. Salim, who is a medical practitioner and, of course, from the Ministry of Health, joining us tonight to discuss this matter of coronavirus and put this matter into perspective. Assalamu alaikum wa rahmatullahi wa barakatuh, Dr. Salim, and thank you so much for joining us tonight.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Doc, I want to go straight into this matter. On the 3rd of March 2021, the Kenya Catholic Doctors Association released a press conference distancing themselves from this AstraZeneca, or rather the vaccination process. And this made a number of Muslims come out and, of course, showed their disinterest in regards to this AstraZeneca vaccine until they get that clarification from the Muslim community, or from the Muslim leadership, or from the religious Muslim leadership for that matter. Doc, you are part of the National Muslims Response Committee on COVID, a consortium that brings together doctors, the Muslim faithfuls, and in today's Friday bulletin, we saw your press release. Now, would you mind putting that matter outrightly, fair and square tonight on Live Real Talk? What is the position of Muslims for as far as vaccines are concerned?
Okay, thank you very much. I want to start from the point where you have started, that the Catholic doctors who have said that they are not part of this vaccine, and maybe some of them were influenced or they're following the same. I want to mention that at the same time, the bishops from the Catholic, they actually say they are not part of what they are medical doctors from the Catholic, what say, they dissociated themselves from that. So it will be unfortunate if some Muslim will be following that sector, but not the bishops themselves. But I'm wondering why they should be following the reference from either the Catholic doctors or the bishop. As Muslims, especially the committee that we have mentioned, the National Muslim COVID Response Committee, which is a consortium of several experts, after looking at what is their evidence and consulting beyond even here, this Kenya, they agreed that the benefit of having the vaccine, it is better and higher than the risk that it has. So, as the committee indicated in the press release, people should have the jab, vaccine jab, but at the same time also follow protocols that have been put by the government in terms of COVID mitigation infection prevention and control.
Doc, on the 4th of April, on the Star newspaper, one of the dailies in this country, a flashy headline came out: no COVID vaccine until the imams approve, say the Muslim faithful. So it's not just a matter of people following blindly. They were waiting for directives from the Muslim leadership on this matters vaccine, because there are a lot of myths and misconceptions and rumors that only either the doctors or the Muslim faithfuls, after deep research, they could make things clear. Okay, so it's not just a matter of blind following. They are afraid. Remember, this is not the first vaccine that is coming with a lot of myths and misconceptions and rumors circumnavigating it, right?
Yeah, what we are talking about is actually what we call hesitancy to accept or to receive something. And that is not new. For all our vaccine and even some other medication, I think there's a lot of hesitancy. And what is important to relieve or to alleviate those hesitancy, to move it, is actually to give facts so that people are informed and they're making a decision from an informed position. They're giving a reference, they're giving evidence, and the best practice that has been done outside there. So I think this instance is not just among Muslims. It is all over, we know. It is in the community. This instance, actually, it's even with some of the health workers. So I think what is the main problem, if you ask me, is people following information or messages that are not authentic, not from an authoritative institution or person, which sometimes is not based on evidence. And I think there is a lot of social media myth and misinformation that is going on. So I will request that what is important is people to ask and get information from the right people and the authorities that are involved.
Okay, thank you. Doc, now one thing that we need to face is that there have been a lot of concerns over the side effects that come with this COVID-19. Just one of the rumors that is spreading around is the correlation between the vaccine and infertility, if there is any in the first place. People are claiming that this vaccine affects the fertility of an individual, right? There's also the rumor that's trying to connect this vaccine and pregnancy. Is there any correlation, Dr., from a professional perspective?
No, actually, studies have shown that the vaccines, they do not affect any issues to do with infertility. And that means they do not interfere with the hormonal balance of a male or a female. They do not alter the reproductive system of any person. And most of these studies are also done in animals, because in human beings we are still going on. It has shown that they do not affect the fertility of the animals that were tested. In terms of pregnancy, I think what is there is that people are asking whether pregnant women should get vaccinated or not. Currently, the studies in pregnant women have not been done, but in animals that are pregnant, they have been done and they've shown that there are no effects. So in a pregnant woman, especially where there are risk concerns, for example, there is a nurse who is working and is pregnant. So the advantages outweigh the risk. So in this case, actually, the person should be given the vaccine. What we advise, if it's possible, the vaccine should not be given within the first 3 months of pregnancy. In most cases, even medication, we try to avoid in this first trimester, because we know is a time that the unborn child is developing, and then there are a lot of changes. So there are no effects, but we are taking precautions.
Doc, what about the other side effects? Sure. What about the other side effects that are
in any
associated with this COVID-19? Because we've had a number of people who have taken the jab, especially the frontliners, those below the age of 58. This vaccine has reacted quite rigorous and quite ugly with them, hence creating the fear in the general community for as far as this vaccine is concerned. Talk of nausea, talk of abdominal pains, that some extend up to 14 days, Dr. Is that true, or what exactly is the situation for as far as the side effects are concerned?
Yes, side effects are there, and it's not just for this COVID vaccine. For most of our vaccines that we give, they have side effects. Because once it is put or jabbed into the body, there are some reactions that go on. But for in Kenya currently, the side effects that have been recorded or people have actually sent for our poison and pharmacy board, there are about 300. And I think about 7 you can say what you can say severe. The rest are just mild. And in terms of these mild the symptoms you've actually mentioned some, the issue of nausea, people feeling that they want to vomit, there is fever, there are body pains, and we also know that there are some people actually have had diarrhea after the vaccine. There are people that have actually had these pains for a longer time. It depends with the person because it reacts differently. Yes, and in some cases, some of them it can take a few days, some cases it can take long. But fortunately for us in Kenya, we have not had any what we can call adverse reactions. These are reactions that will stop somebody completely from performing his day-to-day activities, but it might be uncomfortable and be disturbing.
Doc, then how do you balance that with this report that came on the 7th of April 2021, where the Poisons and Pharmacy Board, they were investigating at least the death of 1 person and 279 cases of adverse effects recorded? That is the Deputy Director Ikamati was saying.
Yes, they are investigating. You have to know that one of the reasons why we want people to record or report their side effect adverse reactions, it is because we want to know what is really related to the vaccine. Let me give an example of the clot that is outside there, and many people are referring to it. Just the fact that maybe somebody had clots or clotting problems after the vaccine, it needs to be investigated, or is it caused by the vaccine? And in terms of clotting, we're not saying that the vaccine is not causing clotting at all, but the percentage or rate is very low. Let me give you some scenario. The vaccine itself, out of 1 million people, it might cause only four people out of 1 million. In terms of if you are, for example, using the family planning pills, it causes from about 500 to 1,200. If you're smoking, you have a risk of about 1,500 to 2,000 people out of 1 million. And if the COVID itself, going to the scenario of the COVID, the disease, it causes about 165,000 persons to get clotting out of 1 million. So in terms of general population, even if clotting occurs, we need to do investigation to see if it was related to that vaccine itself. So there might be other causes. So it is correct, the Pharmacy and Poison Board, they're investigating a death and to see if it's related to that vaccine. Because whether with the vaccine or not, death are occurring. So we need to get back down to the investigation and see if it was really related to the vaccine.
Interesting. Thank you so much. Thanks so much, Doc. So again, is there any risk for those who have underlying hash diseases? For example, talk of hypertension, talk of diabetes. Is there any risk for people with such conditions and this vaccine? Do they have a reason to worry?
Okay, before I answer that, I would like to give an example of maybe a person who should not be given this vaccine. If you have any disease and there are symptoms, for example, even if you have another flu, which might not be COVID, but you are coughing, you have chest pains, you actually should not even take this one. So if you have any other disease and there are symptoms that are severe, you should not take. But if you have some of the diseases you are mentioning, hypertension, diabetes, cancer, we call them comorbidities. That is, you're having other chronic diseases with you. If they are controlled and you don't have any symptoms, you can still take the vaccine without any worry. In fact, as a government, we have included people with these comorbidities as the audience in the first phase. They should actually get this because they'll be more protected, because they are more at risk of getting infection if they do not get the protection.
Doc, while announcing the discontinuation, sorry, I'm not coming from a pessimist point of view, but I'm just trying to debunk some of these rumors that are all over and have spread the public domain currently from the social media, from our social gatherings and the likes, for as far as this vaccine is concerned. So I beg your pardon, Doc, with my line of questioning. I hope you understand, because I just want to get some clarity and some facts from everything that's going around for as far as these vaccines are concerned. So, while announcing the discontinuation of the AstraZeneca vaccine, the director of Tanja Eriksson of the Denmark Medicine Agency collapsed, something that, again, suspected or rumored to be the side effect from the COVID-19. Until today, this was the 15th of April 2021. Until today, no information has been shared about that. Dr. Ari, any word on that? Any opinion on that?
I actually appreciate that you are saying that there are rumors. One, the investigation should be done. Did he faint because of the vaccine? Even if he was announcing about the vaccine, was it related? Was it because of that vaccine? Yeah, it can, I'm not really clear. It is also a possibility. But in that case that you are actually citing, was it caused by the vaccine? I'm not sure, and I would not like to discuss or say that the person fainted because of that vaccine, because I don't have the facts and the investigation.
Okay. Thanks so much, Dr. Ari, for your answer. And that's where we're going to take a break right now, right here on Live Royal Talk. Remember, you're taking to Dr. Salim from the National Muslims Response Committee on COVID, and of course as well serving the great people of Kenya in his capacity as a doctor at the Ministry of Health. Thank you so much, Dr. Ari, for debunking some of this information that have been rumored and moving and circumnavigating the social media over and over and over again for as far as this vaccine is concerned. Of course, a great hesitance is experienced in the community for as far as this vaccine is concerned. And we are going to come back after the break and look at one, which vaccine does doctor recommend? Because there are a number of them in the market currently. There is the Pfizer, the AstraZeneca, the Sputnik, which was recently banned, by the way, from the country. Talk of the vaccine that is mostly recommended. We want to hear that from the doctor. We want to hear, can someone get the jab while fasting? Does it break the fast, right? I'm sure you would also want to know that. And last but not least, if we make up our mind that inshallah, and Doc convinces us and tells us the importance of this vaccine, and we want to go out and get this vaccine, then when is the best time to be vaccinated, and where should we get these jabs? This and much more after the break.
Horizon TV, the beacon for the nation.
Furaha ya nyumba ni familia, na furaha ya familia ni uwepo wa chakula kitamu. Kwa mapishi matamu ya aina mbalimbali, usikose kuungana nami Mariam Salim ndani ya idhaa ipendayo Horizon TV.
Horizon TV, kurunzi ya taifa.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much for keeping it live, Roll Track. And tonight we are talking about matters vaccine and everything to do with the vaccine in this country. We have gotten information, authentic, accurate information from Dr. Salim for as far as this vaccination is concerned. And now we want to know more about the vaccine. Now, Doc, you have debunked a number of information for as far as the vaccination is concerned, and matters to do with pregnancy, infertility, lifestyle diseases, that is underlying conditions. Now, Doc, want to know, one, which vaccine is recommended? Which vaccine would you recommend? We've seen a number of them in the market. There is AstraZeneca that's widely rolling out in the country, but some people are a bit hesitant from taking that AstraZeneca. They would prefer other brands of this vaccine that are ongoing globally. Talk of the Sputnik, the Pfizer, and the like. So which one would you recommend and why?
Okay, thank you very much for that question. I think I'll start from the position that we have AstraZeneca in Kenya, which had been allowed by the government. We know there was the issue of the Sputnik, but it was discontinued. And I want to say that the government currently is very cautious in terms of what comes in and who takes responsibility, because most of these trials, they requested for emergency trial use. So the government, the one that is bringing in, it has actually an indemnity that it has taken. So the question that which is the best or which, very important thing for a person to know is that if you get any vaccine, it's better than not having any at all. And if you are to choose between one or the other, I think there's some misinformation outside there. Let me give an example of AstraZeneca compared to either Sputnik or the Moderna or the Johnson & Johnson. Some people are the efficiency or the efficacy that has been quoted. For example, whether it is 62, whether it is 95. I think I want to caution people, and the understanding of this should be very clear. When you're talking about efficiency of that vaccine that has been quoted, it is not the efficiency or the performance in an individual. It doesn't mean that if a vaccine is 5%, it means that it will work well only 65% in your body. Or if a vaccine is 95%, it will work 95% in your body. That's not the understanding. The understanding is these trials were done in a community. So if a vaccine, for example, is 65%, it means out of 100 people, it protected 65. It is not that it is only efficient 65% compared to the other one, which is 95. So it's important that in your body, it actually, whether it in the community it was 65 or 95, either vaccine will protect you at the same level. Let's say, I'm giving an example that it might be 100%, all of them. But the other one, when during the trial, in the community, in the population, it was 65. So I think this is very important for people to understand, so that you should not base that to choose a vaccine. So what I can say in terms of recommendation, any vaccine that you have is better than not having at all.
Thank you. Thanks so much, Dr. Ali, for that. Now, this has come at a time when Muslims are observing the annual fast that is prescribed upon them in the holy month of Ramadan. So, what's your advice? Can someone take this jab while fasting?
Yeah, I've actually taken mine today, and
Really?
I'm fasting. Yes, I took time to take it because I actually had coronavirus. I was affected from February 27th. And we usually advise that once you have coronavirus, you should not take the vaccine until you are healed, you are negative. And once you are negative, you actually take about 4 weeks before you are given that jab. I think that's what is very important. Despite that there could be some side effect, ideally it does not hold somebody's fast in terms of you're not taking anything by mouth. This is injected into the muscle of the upper arm of the left arm. That is if you are right-handed, and left-handed you shall give the opposite. So I didn't think it is the fast, and as we are speaking, no side effects. I'm quite well. Thank you.
Doc, sorry, just want to get more details about that. So how long ago did you take the vaccine? How many hours ago? How many minutes ago?
Around 8:30.
8:30 in the morning. How do you feel right now, Doc?
No, nothing. Personally, I have no effects. What we usually advise people, after they have given the jab, they should, for 15 minutes, they actually should relax where they are. If possible, they should not move. They should just stay at the same place so that the person who has given the jab and other people around have that one. After 15 minutes, the person can go and they do his normal duties. But personally, I have no effect, not doing anything different. As you can see, I'm talking to you, and I was working actually before I started the program.
Wow. So it doesn't affect the fast or anything for that matter. So Muslims can go and take their jabs.
Yes, and we should also realize that when we are saying there are side effects, it doesn't mean it will occur to everybody who takes the jab. So it is only some people who will have those side effects. It doesn't necessarily have to happen to everybody who has taken the vaccine.
Doc, if one, hypothetically speaking, is not guaranteed of getting the second jab, and the medics have advised you have to get at least 2 jabs for you to be now fully protected from COVID, if one is not guaranteed of getting the second jab, is there a need, hypothetically speaking, is there a need to go for the first jab in the first place?
Yeah, I think it is still important to go for the first jab. But before I answer that, I want to alleviate the problem that you will not get the second jab. The government is already ordering. There's a consignment that have been ordered. And what is important also is to know that the duration between you get the first and the second jab for AstraZeneca is recommended between 4 weeks and 12 weeks. So it means you can still wait up to 3 weeks till the first time you got your first jab to get the next. And fortunately, most of us did not get the jab at the same time. So it means when the consignment comes, those who were given the jab in the initial phase or went fast will be the ones eligible to get the second dose before us. And we will inform you or we remind you, because there is a digital system and a message comes to you that you have done. Personally, like today, message has come that I've had the jab, and they've even given me the date when I will have my second jab. So to your question, it's very important for somebody to have this jab. Evidence has shown that once you get the first jab, you start getting the immunity between 7 and 10 days. And actually you're protected up to around 75%. So when you get the second jab, we are assuming that it will be higher than that. So even if you get the first jab, you have more protection than the person who did not have the jab completely.
Very, very, very important information, Doc, you mentioned there, because now there are people who have gotten the jab and moving around carelessly without observing the COVID-19 protocols, that is from physical distancing, masking, washing or sanitizing their hands and all that, avoiding to touch the inlets, be it the nose or the mouth, and so on and so forth. What would you advise? I mean, does this jab insulate a human or insulate an individual from getting this virus?
I think that's very important for all of us to understand that despite that getting the jab, is still supposed to continue with the other protocols that have been put. As you've mentioned, washing hands, very important with soap. Wearing a mask, especially where you're in public, you have to keep the distance wherever it is possible. So it doesn't mean that the jab allows for you to lack the other protocols. Studies have also shown that you can still transmit the virus later if you get it, even if with a jab. You can get also infected with the virus. The good thing is that most of the time, if you are infected and you had the jab, the severity will be less and the transmission rate is also. You should still follow the protocol because you can still get infected and you can still transmit later if you get.
Thank you. Doc, someone argues, I'm getting a text here among the many texts that I've received, and this one just caught my eye. Someone argues, says that I contracted the virus and my antibodies already fought the virus to its death. So why do I need the virus right now? Yet I've survived a couple of weeks without the virus, a couple of months rather, without the virus. And my antibodies have proven to be strong enough than the virus, and that's why I'm okay right now. So why do I need the virus, the vaccine, sorry?
But the argument, that means that he's okay or he can fight the virus, one might not be quite. It is known that what they're thinking about immunity, active immunity, shown that it gives you a higher protection and stays longer and when you're passive immunity. So that's why it is important for you to get the jab. But I think for me, as I mentioned earlier, get the jab immediately or with some time frame of 4 weeks after you have healed and you have been negative. Because at that so each time, at least after you have turned negative.
Okay, lovely. Doc, last but not least, as you're wrapping up this conversation right here tonight, where and how does herbalist or herbal medicine come in? Do we have any herbal or herbalist who can give us an alternative to the vaccine?
We don't know herbs that can be used and that can actually protect you from getting the virus, or they can.
Doc, I interviewed a professor, Professor Mohammed Hussein Abdillah, a few weeks ago, who has developed the CR7 formula that is COVID remedy 7 natural herbs that, according to him, it not only cures but prevents a person from getting corona. And he showed us some testimonials and he showed us texts of people who have actually testified that they've gotten cured from COVID-19. So can I take CR7 instead of the vaccine?
Let me go back to research. You have said some people have given testimony.
Yes. I beg your pardon, Doc.
And
You are breaking. Would you mind coming back again?
I'm saying in terms of research, medication, and vaccine that we are using, we actually go by trial. Somebody has to give evidence, the three phases that were actually given that medication, how many actually are, so that you get the efficacy rate and all that. We usually don't depend on people saying that I was ill because I took. In my house, when we got infected, there are some of my children, after 2 days, they were okay. They didn't have any symptoms, but they were positive. I was infected for 2 weeks. I had some mild symptoms. My wife actually had to be hospitalized and be given oxygen. So if my child, for example, had been given that, and then he said he was healed, will we know it is a drug or just because of his own immune? So we cannot use testimonial. We need to use the trial evidence and how many people were actually were healed or protected. So
Doc, but he's a professor, a research. Sorry.
Yes, I've not seen that, and it has also research being done or somebody using something. Has also to go through peer review, and there are bodies globally and also nationally that should be involved and verify the same. So whatever you're mentioning, personally, I've not seen it, I've not read about it, so I cannot say it works or not.
Okay, good. But do you agree, or rather, what would be your advice on the herbal aspect of it? If someone comes up or develops a herbal, maybe that would try and boost someone's immunity to fight against the virus, would you recommend that?
That even WHO had asked people who had said they have either herbs or concoctions that are working to send them to them for verification and trials. So it's not that the might work, but people dosages for the same. So if somebody has, even in Kenya, they can work with the same rate. But the issue you're asking about herbs boosting your immune, it is known vitamin C, vitamin D, zinc are important, especially when you are sick or so if you can get these from herbs that are being used, then they'll help you boost your immune.
Thank you so much, Dr. for that. As we are wrapping up this conversation, where and who qualifies first? Who qualifies for this vaccine? The roles that are, the doses that are outside there, and two, where do we get it for those who qualify?
I think currently the government has 3 phases that is going to give this vaccine, and in this first phase, the people that are supposed to be, the audience that is supposed to be vaccinated, what we call the essential workers. And the essential workers include health workers, it includes the armed forces. The armed forces, it means people who are in uniform, that our police, our army, and the like. Then we also have included our community health volunteers. These are volunteers, people who go to households to give health information.
We are having a problem right there with Dr. Salim, who was explaining to us where, and yeah, Doc, you're back. You're explaining something about the frontliners. Having some connectivity issues right there with Dr. Salim, who was talking to us about where and who qualifies for the vaccination. And from the top of my head, of course, I wanted an information with authority from him. But from the top of my head, he said, one, the frontline workers, that is the security apparatus, talk of the army, talk of the police officers, those people do qualify. Talk of the medical workers, they all qualify for this vaccine, and the media as well. Hatujasahulika tuko hapo ndani for those people who are supposed to get vaccinated as fast as possible. So for all my colleagues outside there, you can get to any vaccination center closest to you. There are a couple in every county. There are a couple of centers across the country right now where people get vaccinated. And of course, the elderly from our community, those above a certain age. I'm not so sure, Ibrahim, is it 68? Is it? They're the ones who are eligible to get vaccinated? Yes. Yes.
58.
58, not 68. Now, yes, you're back, Doctor. Your internet is restored. Now you can go ahead and continue.
Yeah, amongst the ones you have mentioned, yeah, the elderly, also religious people, because they have congregants, they're supposed to be in this first phase.
Okay. Thanks so much, Dr. for making time for us this evening. Asante sana for the information that you've shared with us, and I'm sure our audience, they have benefited as equally as I have benefited as well right here in studio. So if you're convinced, go get your job. If you fall in that category of the frontline workers, go get your job right now. Don't even spare any minute from now. My floor manager, Mohammed Obure, is standing by my side. Obure, you want to come and say hi to the audience?
Hi to the audience. Oh,
Assalamu alaikum. Come on. Okay, so this is Mohammed Samobura, my floor manager tonight. Thank you so much. And Mohammed Gitonga right there doing his thing. Come on, brother. Come, Mohammed Gitonga. Nishakutaja kwa screen. Come on. That is Mohammed Gitonga. This guy is always behind the TriCaster. Very camera shy person. He's always behind the TriCaster and making the magic work, just like his counterpart, who's the head of technical, Ibrahim Muhammad. They're both camera shy people. They don't even like the phone camera, let alone the camera on the screen. Guys, thank you so much. That has been the live Royal Talk. See you next week, same place, same time, as we are tackling another issue that you, our viewer, want to listen to. I've been your host, Faisal Kassim. Thank you so much for all those who made this possible. Thank you so much, Dr. Ari, once again for making time for us this evening. Thank you so much. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
Horizon TV, the beacon for the nation.
Allahu Akbar.